Do you experience severe pain during your periods? Are you someone who has to take off from work, you have to rest at home, have to take painkillers? Are you someone who's also having difficulty or painful intercourse? Do you know what information this symptom will give to the doctor? Are you wondering whether to see the doctor to understand if there is any pathology here? If these are the questions hovering your mind, then this video is for you. Hello everyone, myself Dr. Indu from Samruddh Fertility and Urology Center. Let us understand why some women experience excruciating pain during their menses, which affects their normal activity for the day. Allow me to share 5 different causes of painful menses. Let's go deep into it. Before we understand the details of different causes, let us understand what normal menses is. A normal menses is when a woman is having her menses once in 21 days to 35 days in length. She shouldn't be having severe pain during menses. Her flow should be somewhere between 3 days to 5 days to 6 days. Ideally, there should not be any clots. Also, she should not have any kind of bleeding or spotting in between menses or after an intercourse. Such a cycle is called as normal menstrual cycle. What is menstruation? Menstruation is when the lining of the uterus is formed in anticipation of a pregnancy to get implanted. When this does not happen, then the lining sheds out and it is coming out of the body in the form of bleeding. Some women may experience mild pain, mild discomfort or mild cramp during their menstrual cycle, and this is absolutely fine. Why do they get this mild pain? This is because of the release of a natural substance called as prostaglandins. Let us look into the other causes of painful menses. What are they? They are number 1, endometriosis, number 2, adenomyosis, number 3, pelvic inflammatory disease, number 4, fibroid uterus, number 5, reproductive tract abnormalities. Number 1 reason is endometriosis. Endometriosis is one of the commonest cause of severe painful menses. Now what is it? In endometriosis, the uterine lining cells are also present outside the uterine cavity, that is commonly in the ovary, fallopian tube and the pelvic cavity. Now whenever there is bleeding that happens inside the uterine cavity, this comes out of the vaginal cavity in the form of menstrual blood. Similar bleeding also happens in other cells which are present outside the uterine cavity. Therefore, every month when a woman bleeds, there is bleeding happening inside the pelvic cavity, and this gives a woman painful menstruation. So the second cause of severe painful menses is adenomyosis. Adenomyosis and endometriosis actually have a similar pathology. In adenomyosis, these cells, the uterine lining cells, are creeping into the wall of the uterus. So whenever a woman has menses, there is severe pain because the bleeding is occurring also in the uterine musculature. So in adenomyosis, women not only experience severe painful menses, but she actually may have heavy flow or heavy bleeding also. The third cause is fibroid uterus. What are they? They are non-cancerous tumors. Basically, it's an overgrowth of the muscle of the uterus. Now they can be located either on the surface or in the muscle of the uterus, or it can be also seen inside the uterine cavity where the implantation happens or where the shedding happens. So basically, when the location is inside the uterine cavity, a woman may experience severe pain during her periods. The fourth cause of painful menses is PID or pelvic inflammatory disease. Now this is an infection of the reproductive structures. It can be either an acute presentation or it can be a chronic presentation. Here the infection happens mostly because of the sexually transmitted diseases. The pain that happens is mostly because of lot of inflammation that is present in the pelvic cavity, lot of congestion that is seen in the pelvic cavity. The fifth cause of crampy painful menstruation is reproductive tract abnormalities. Now these abnormalities are formed when the woman is inside the mother's womb during her intrauterine life. Now the abnormality can be varied. One can have a unicornuate uterus or a bicornuate uterus or a septum inside the uterus or in the vagina. If the path is not properly patent, open, it leads to obstruction. This can be a reason for severe crampy pain during menstrual cycles. Some of the women may not have the above reasons or the above causes for crampy menstrual cycles or painful menstrual cycles. So why are they still getting severe pain? One reason is they might be secreting a high amount of this natural substance called prostaglandin, which is secreted in excess amount, leading to severe pain during period. Another reason is, which cannot be ignored, is excessive stress. If a woman is going through a lot of stress, then this could also be one of the reason of severe pain during menses. How do you treat or manage the painful menstruation at home? The simplest thing is to take a paracetamol that is easily available at home. If this does not help, then one can consider taking higher painkiller. But remember to consult your doctor, because taking a higher painkiller very regularly, very often may give you gastritis or cause kidney problems. Then the other ways of managing is applying a heating pack or a warm water bottle that is wrapped in a towel, which is kept under the tummy in the lower abdomen. That might give you pain relief. Then other ways are warm showers, warm bath, then giving a gentle massage over the lower tummy may be sometimes beneficial. Exercise is also another way of managing pain. Definitely not when one is having severe pain, but how exercise helps is exercise releases endorphin, and endorphins help in reducing the pain. Then there are other ways such as listening to music, soft music, getting an acupuncture done, of course by a specialist, not by yourself, by Google surfing or checking on the YouTube. Then having a good sleep, yoga, meditation, these are other ways to bring down your pain. When simple measures and other homemade remedies have really not benefited, then it is time that you consult a gynecologist. Remember to take your proper details of your menstrual history to the doctor, and when such a patients come to me, then I take their proper history, do their examination, do a scan, and if required also blood test, and then they are given medical management. What does this involve? It is basically hormonal medications that are given. Number one, that can be a progesterone medication. Number two, combined oral contraceptive pills. Then number three is intrauterine devices that has a hormone impregnated in it. Such medical management generally helps. If this medical management does not bring much relief and there is other cause found that needs a surgical correction, then definitely that is the next step forward. Now the surgery is mainly through laparoscopy. This was all about painful menstruation, about its causes and how to manage. I hope this information was helpful, and if you found it useful, then do share with the ones who need it. I shall see you soon in my next informative video. Till then, take care, stay strong, stay positive, be grateful.